Bhatia, please be seated. Welcome all of you. So we're going to have a very interesting session today, and I welcome you with my whole heart. Saw such a good response. I'm so happy to see all of you here. Weather is good outside, and we just finished with the Lohri and Makar Sakranti celebrations, and congrats to everybody. So we're discussing something on diabetes today. We are sitting in the capital of India, and the country is, the capital in diabetes in the whole world. We will soon be the capital. We are almost. So it's like an epidemic already we are having. India, with one of the largest and most diverse populations of people living with diabetes, experiences significant barriers in successful care. Limitations in appropriate and timely use of advice and medication impedes the achievements of good glycemic control. The economic burden due to diabetes in India is amongst the highest in the world. The real burden of diabetes is due to its micro and macrovascular complications, which leads to so much morbidity and mortality. So we have with us two speakers. They will be very brief so that we have time left for some interaction. The first topic to be covered will be the science of diabetes reversal. For this, we have with us Dr. Hemi Suneja. Dr. Hemi Suneja is consultant endocrinologist at Max Smart Super Speciality Hospital, and she is also faculty at University of South Wales, UK, for the diabetes and obesity medicine diploma programs. She has done her family medicine residency, followed by fellowship in obesity medicine from US and endocrinology department from UK. She has over 15 years of clinical experience, and having been a family medicine specialist, she is a firm believer in preventive medicine and a holistic approach to the whole thing. So I request Dr. Hemi to please give her presentation. Please welcome her.
Thank you so much, ma'am, for the kind introduction, and thank you all of you for sparing your time to come out for this talk in the middle of the day today. I don't think there's anyone here who would be able to say today that I don't know anyone with diabetes, whether it's family members or it's patient. I think whatever specialty we are in, we are going to come across people with diabetes, and a lot of us, I'm sure, do have other people in their family with diabetes. So, as ma'am said, I did most of my training in UK and US, and I came back with that passion that, I want to do something for the patients which is going to give them that wholesome care. One of the most important things which we find in India is just the sheer numbers that we come across, whether you're sitting in the OPD, whether you go out on the road or you go out in the metro. And I think that compromises the quality of care that we are being able to deliver to them. And diabetes is one such thing which is very much lifestyle related, and people don't really realize how bad it is till they don't come across what exactly it should be. So, conventionally, whenever we talk about diabetes, even at the time of initial diagnosis, a lot of times people have this question, Doctor, अच्छा मेरी diabetes पूरा ठीक नहीं हो सकती क्या? So this is a very common first thing which they have, and there used to be a time when we would tell them कि नहीं भाई diabetes तो रहेगी कि हाँ उसको control में रख सकते. But now there really are a lot of studies coming up which are showing that intensive lifestyle modification can actually help reverse the disease process for them. And the earlier on we do that for them, the better the success rates. So we are going to be talking about some of the evidence behind. The first thing that I'm going to be covering is what do we exactly mean by diabetes reversal, and is it reversible or not, and why is it that we're not being able to help our patients being able to reverse their diabetes. And we will be talking about a few case discussions also. So diabetes reversal is a term which is given to significant long-term improvement in insulin sensitivity in people with type 2 diabetes. And people who are being able to get their HbA1c below 6% without having to take medications, or they are called to have reversed or have resolved their diabetes. And talking about whether it is reversible or is it not. So I have a few slides regarding some of the recent studies which have been published in the last couple of years. One of them has been this direct study in which they looked at a remission of type 2 diabetes patients in north of UK and Scotland area. They randomized the patients through intensive lifestyle modification compared to just a regular diet and compared to a regular diet and lifestyle advice. What they saw is that remission was achieved in almost half of the participants in the intervention group. 50% of them were actually able to achieve remission in their diabetes. And in 86% of those who achieved desired weight loss, they were actually be able to stay off of their diabetes medications with well-controlled blood sugars over a long term, which is a big number. So even if we can get to say 25% in our population, I think even that is a big achievement. Another study, which was the Finnish diabetes prevention study, in that also they saw that intensive lifestyle intervention in patients with high risk of type 2 diabetes can result in 43% reduction in the relative risk of developing diabetes in the near future. Another one, the active randomized control trial, in that also what they saw that intensive diet intervention soon after diagnosis can help improve the glycemic control. And in this, they actually compared diet and exercise. So what they saw that with diet itself, there was significant improvement in their diabetes, and that improvement was not quite increased so much with the addition of physical activity. Having said that, having quoted that study, I don't want you all to go home with the message that theek hai, bas khana wo change kar lete hain, we don't need to do the exercise. Exercise definitely has a lot of other benefits which are over and above the glycemic control. So something to be kept in mind. Now, why is it that we are not being able to help our patients reverse their diabetes? I think let's make this part an interactive one. Let's start from here. Why do you think we are not being able to help our patients being able to reverse their diabetes? Any thoughts about that? Can you pass on the mic to her? So we ourselves are not being able to control that or reverse that. Any ideas or thoughts on that?
Madam, 60 to 70% beta cells are already lost.
So, but we still do have the 30 to 40%. So why, as doctors, when we have that information, when we know that okay, diet is, having a good diet is good, exercising is good, why are we not being able to do that for ourselves?
Those are the worst patients.
Absolutely. So I think there again comes in the issue of compliance. So चाहे कितना भी counsel करते रहो, I remember when I initially moved back from US, I used to give my heart and soul into each and every patient. My consultations would go on for half an hour, 40 minutes, telling them about diet, exercise, ऐसे करो, do this weight training, breathing exercises, showing them all of those. And they would come back a month later, they still have all the information with them, but they are not doing that. So compliance becomes a major factor. When we talk about diabetes reversal, I know there are studies which are showing in patients after bariatric surgery as well, they are being able to go into diabetes remission. It's because they've had significant weight loss within a reasonably short time interval. And so it really does boil down to that excess weight in a major portion of people. With Indians, the other issue that we have is the increased abdominal circumference. So even at a lower BMI, we are unhealthier compared to a Caucasian counterpart. So same BMI pe, we have a higher fat percentage compared to a Western population. So that is where comes in the big role of diet. A lot of times you will have people who are like, oh, मुझे abs की exercises करने, मुझे abs बनाने, 6-pack, 8-pack and whatnot. But one thing to remember is that the muscles are existent, but they are just not visible because there is just so much fat around them. So it is not just about increasing the protein content, it is not just about doing the abs exercises, it really does get down to decreasing the fat percentage. And what has also been seen is that the peripancreatic fat, I'm not talking about the subcutaneous fat or the visceral fat overall, even the peripancreatic fat, even if there is a reduction of around 5 gram, 5 gram की बात कर रही हूँ मैं, which is like 1 teaspoon of salt, less than 1 teaspoon of salt. Even that much decrease in peripancreatic fat can help improve our insulin sensitivity. Okay, so it is not that it is a lot of huge amount of hard work necessarily, but it's always about training ourselves and understanding that yes, it is a reversible condition, and that is how we have to reset our minds. It is not unachievable. We can definitely do that with the right kind of interventions and with the right kind of modifications. So I was in search of something which will make it possible for my patients to be able to reverse diabetes, and that is something which always at the end of the day would keep bothering me. कि हमेशा बस मैं दवाइयाँ तो और लिखती जा रही हूँ. I know all the posh medications, all the latest medications, but we are still not being able to help our patients. And then I came across the CMD team, the Cure My Diabetes team, and met up with them for the first time, and I was definitely very, very impressed. And I was like, okay, this is something which I really want for my patients. This is something which my patients would really benefit from. So that is when my association with Cure My Diabetes team started a few months ago. I'll be discussing about a few case examples. These are real case scenarios, and these have been my patients for a long, long time. And going to discuss 3 patients. All 3 of them, it's not that they had been non-compliant patients. They actually had been very, very compliant, very particular about their diet and exercise, trying their level best to do as much as they could for their health. They had also been very motivated, and even then they were not at a good level when it came to their diabetes control. So this is our first patient, Mr. RG. He was overweight. He was weighing around 119 kgs when we started seeing him. He was already on total of 163 units of insulin a day, of which 100 units was the long-acting Degludec, and the rest of it was the concentrated Humalog, 3 times a day. In addition to that, he was on a once-a-week dulaglutide and metformin twice a day. So quite a bit of medications, quite a bit of high dose of medications, and even with that, he had a HbA1c of 9.3. And this is when he had been walking around 5 to 6 kilometers a day. So he was quite motivated. This is a graph, this is the sensor reading graph which we have. So day 0 here, evening time is the time when he started the meal plan. So what the Cure My Diabetes team does is that they make and deliver the diet for the patients, which is customized according to their taste and their caloric requirements. And so they deliver the meal on day 0 here in the evening. So initial 1 day is the baseline. This is the picture. This is the image of the glucose sensor reading. Glucose sensor is a special device which we have nowadays, which checks your blood sugar levels all throughout the day and night, and it is saved in the sensor, which we can scan every few days to see how your blood sugar levels are doing, and accordingly make adjustment in the blood sugar medications. So as you can see, initially these gray border is an area where we would want our patients to have their blood sugar levels. So lowest being 80 and going up to 180. And this patient, he had an average blood sugar reading of around 242 on all those bunch of cocktail of medications. Started the program the next day, and as you can see, on here is when he started the program on day 2, day 3. His blood sugar levels average came down to 104 from 242. And by this time, we had to stop all his mealtime insulin. So the 3 times a day Humalog was gone, and on day 4, he was only on 34 units of Degludec once a day. Earlier, he was taking total of 5 injections a day, and on day 4, he was down to just 1 injection a day and just 34 units altogether. So it had been almost 8 years that he had been on those 5 shots a day, and he really did not remember the last time he had a meal without taking insulin shot before that. So definitely a very, very good response. I don't think, he had been trying to adjust his medications, insulin around, but not really being able to achieve that. And this is diet therapy, only diet therapy which has made that change. So there is magic in food. So diet is something which we have to take as a therapy. It is not just about putting whatever you can, lay your hands on. So very, very important to keep that in mind, very important to emphasize that with patients. So this patient, around 4 weeks later, he had already lost 6 kgs weight while being on that diet. The creatinine improved, his sleep apnea improved, so he was not needing the CPAP mask anymore. And this is just with 1 month of that therapy. And he's being able to walk around even more and feeling much more energetic. It's all good stuff. Coming on to the second patient, again another challenging patient, Mr. MC. He was 75-year-old, and he had type 2 diabetes for the past 28 years. His main issue was very labile blood sugars. He was on a mixed insulin 18 units a day, Humalog at dinner time, and liraglutide once a day at night. And as you can see, initially he had really high blood sugar levels with a lot of fluctuations. So he started his meal plan from this day in the evening. From next day itself, he started noticing improvement, and within the 3rd or the 4th day, as you can see, his blood sugar levels, the average had dropped down from 369 to 202, just 160, 164, with a lot of stability compared to how it had been before. And then another patient, so Mr. MP, he was also overweight, type 2 diabetes for the past 15 years with a BMI of 34. His blood sugars had settled down quite a bit compared to how he had been till a few months ago with medication modifications and things. And now he wanted to look at weight loss and being able to get off of his insulin. So I got him started on the meal plan on day 0 here. And before that, he was on 33 units of insulin. From the next day, his fasting sugars were much better, and we decreased his insulin doses down and gradually kept on decreasing that. And now he's only on 8 units of Rhizodec once a day, and metformin 1 gram twice a day, and once a week dulaglutide injection. So definitely seeing a lot of improvement in his physical activity levels also. So I would like to conclude my talk here with the message that there is a solution, and we just need to put it to use and help improve quality of life for our patients. So definitely diet is something which we really need to pay attention to. And I think we would now go on to Dr. Furman's talk. Dr. Furman is a family medicine physician based in US, and he's been involved with the nutritarian diet for a long, long time. I'll hand over the mic to Mr. Junior Gupta, who's going to connect us to him.
I would just need 1 second to call him. It's 3:40. Hey, let me
He's
just...
there already.
All right. Sound? Dr. Furman, can you say something?
I can,
Yes.
stop here. I
Yes.
can't see you though. Can you put on your camera?
The camera, yes. 1 second. 1 second. Where's my camera button? Hold on. Let me figure that out. There we go. I turned on the camera.
I got
think
it.
you're seeing me because of the laptop. I don't know if I can turn it around, but I'll try to.
Okay. Wants to see.
All right,
audience.
Dr. Furman. Can
Yep,
you see
I
now?
can see everybody now. Okay, we're good.
So you can see us now?
Yes.
I can see everybody.
Yeah.
Nice.
Okay.
Well. All right. Nice to see all you in the middle of the night.
All right, Dr. Furman, the floor is yours.
Okay. Well, I'm here to talk a little bit about our program for reversing diabetes and my 30 years of work in making diabetics non-diabetic. I published a pilot study where all the participants except one were able to get rid of their diabetes, their type 2 diabetes, within 6 months by using our nutritarian approach, which is a diet high in micronutrients and fiber, and most of the carbohydrates are foods that come from slowly digestible starches that are high in resistant starch. People often call those foods, those carbohydrates, that have a low glycemic load, mostly consisting of beans, lentils, and peas. So we remove or reduce greatly the higher glycemic carbohydrates, especially those coming from flours, including whole wheat flour. In other words, we're taking away breads and pastas and white rice and even brown rice because it's higher glycemic effect. Nevertheless, the nutritarian diet is moderately caloric restricted with a high amount of phytochemicals and antioxidants and fiber. So we're talking about the only proven methodology to extend human lifespan. That means to slow aging and extend human lifespan is moderate caloric restriction in an environment of micronutrient excellence. So we rate all foods based on their micronutrient per calorie content. And the micronutrients don't just include vitamins and minerals, but also phytochemicals and antioxidants. When our body metabolizes calories, it produces free radicals, reactive oxygen species. And colorful plants contain the antioxidants and phytochemicals to negate the production of free radicals and reactive oxygen species. Because the development of diabetes is not just because of the high glycemic load of the diet hitting the stress of the beta cells in the pancreas. It's also because of the lack of phytochemicals and antioxidants that allow aging, the premature aging, and inflammation to build up in the body. It's the combination of the inflammation from the reactive oxygen species and the buildup of advanced glycation end products on tissues that's the deadly combination that fuels aging and fuels diabetes. And a nutritarian diet does both. It removes the advanced glycation end products and lowers the reactive oxygen species by giving a diet high in phytochemicals. The definition of a diet high in phytochemicals means a diet high in green vegetables in particular, because green vegetables are the foods with the highest amount of micronutrients per calorie, and they're naturally very low in calories. So there are some foods that thicken the microbiome, that cover the villi. In other words, we thicken the biofilm that adhere to and cover the villi in the small intestines, that reduce the glycemic effect of all foods. And scientists call that the second meal effect. It means when you have an apple or a mango, the glycemic effect of that piece of fruit is reduced dramatically because you regularly eat these 4 foods that create a thickening of the microbiome that slowly absorb the glucose. And those 4 foods with the effect to change the microbiome and change the glycemic effect of everything you eat are 2 cooked foods and 2 raw foods. The 2 cooked foods are mushrooms and beans or legumes, because beans and legumes, the carbohydrate, have the most resistant starch. and the resistant starch are resistant to enzymatic degradation. The digestive enzymes can't break them down, so they're degraded by bacteria into short-chain fatty acids. So that they become a fuel for those bacteria, and the bacteria lower the glycemic effect. So when they eat mushrooms and onions, when they eat mushrooms and cooked carbohydrates and raw greens, like raw cruciferous vegetables, like kale and collards and bok choy, so raw green vegetables, more raw leafy greens, with raw onion or scallion. It's the combination of those four foods, the raw onion, scallion, and the raw green leafy vegetables with the beans and the mushrooms. That combination has an effect to lower the glycemic effect of everything you eat and help reduce diabetes. So fiber too is degraded into short-chain fatty acids, but the resistant starch in beans and resistant starch in peas are very, very high in that ability. And those short-chain fatty acids, like butyrate, send signals back to the hypothalamus to reduce apostat. So when you eat oil in your food, like you pour oil on your food, oil signals the hypothalamus to eat more calories. And it triggers dope, because it's absorbed so rapidly, it signals dopamine receptors in the brain to light it up. So you become a monster, a calorie-eating monster. You can't stop wanting to overeat because you put oil on your food. So oil and salt and sugar feed that apostat monster, which makes people overeat and get overweight. But the opposite effect is when you eat high fiber, high resistant starch foods, because the butyrate, the short-chain fatty acid, butyrate, has effects to reduce the hypothalamic desire for extra calories. It lowers your caloric drive. It helps you get put back in touch with being comfortable and desirous of less calories. So it's the bulk, the fiber, the phytonutrients, the microbiome effects, and the feedback loop to the hypothalamus are all generated in a beneficial manner by the high uptake of these high fiber foods. So a nutritarian diet is also hormonally favorable because because we're picking carbohydrates that are more glycemically favorable. The lower levels of body fat make you lower the level of estrogen production by the fat supply. And as people are losing weight on this diet, about 2 pounds a week, that means about a kilogram of weight loss every week until they get within 10 kilograms of their ideal weight. So we're talking, then they go down to maybe half that. So people are losing about a kilogram of weight per week, and as they're losing weight each week, it reduces the negative effects, the pro-inflammatory mediators secreted by the fat cells and the estrogen production from the fat cells, and also the angiogenesis promotion from the fat cells. So what I'm saying now is people are dropping weight at 1 kilogram a week. The insulin resistance from their fat cells are diminishing, and their inflammatory effects of fat are diminishing, and the estrogen production from fat is diminishing. So and also you start to lose the blockage of the insulin resistance as they're losing weight at that rate before all the weight is lost. So people who are still overweight can still have reduction in insulin resistance and see dramatic benefits in diabetic control, especially because saturated fats block the cabalae. The cabalae are those pockets in the cell wall where the insulin receptors are sitting that are blocked by saturated fat, increasing insulin resistance. So the butter, ghee, animal fats, and saturated fats, particularly from animal products, can make you more insulin resistant. And a nutritarian diet helps repairs the cabalaes. So you're not going to reduce the insulin resistance, and it does so pretty quickly. Usually within 1 month, we're seeing insulin resistance drop, even while the person is significantly overweight. So we're talking about a diet that's glycemically favorable. It's very high in micronutrients and antioxidants. The carbohydrates are scored on a hierarchical scale of quality based on their nutrient content, their amount of fiber, and their amount of resistant starch. And of course, we're enabling the body's self-repair mechanism because we're making people more in touch with their instinctual drive for hunger, so they require less calories, and more repair goes on in a non-feeding state. So we're extending the time of the hours they're spending not eating. We call that the catabolic state, when they're not digesting food and not eating, so their glucose level is living off of the glycogen that's stored. So we're eating an earlier dinner so they can spend a few hours with not digesting food before bedtime. They extend that catabolic window of no food at night, no digestion, to at least 13 to 14 hours per day, which is another factor that accelerates their reversal of diabetes. When we incorporate this diet style, these methods in diabetic patients, we're able to cut their medications down by more than 50% in the first 2 days. And then the subsequent following of them over the next month usually necessitates our weaning off all medication within the next 4 to 6 weeks, where they become non-diabetic. And we're saying non-diabetic, meaning that they don't require medications and they have normal blood sugars, but of course they're still prone to diabetes should they go back to it and gain weight again, or go back to an unfavorable diet with more oil, with more rice, with more flour, with more bread, with more animal products, or with less choice of the more favorably glycemic carbohydrates. So I can open this up to questions, but before I do, let me just tell you a few cases of people where it's not just getting rid of their diabetes. It's like people are faced with dialysis, with worsening renal function that gets better. People are faced with chronic infections and foot amputation. So I had this guy who went to his podiatrist and was told he was foot amputated due to chronic infections because they were going to become gangrenous. And the guy started crying to the doctor in the office. So the podiatrist finally said, okay, go to Dr. Steve downstairs. He's using a nutritarian diet to reverse diabetics. So of course, what the point I'm making here is that this man didn't start crying in the doctor's office about the potential loss of his foot. It would have never been mentioned to him as an option to get well from diabetes through a more aggressive dietary change. Of course, he went down to Steve downstairs and lost 80 pounds, got rid of his diabetes and saved his foot. But this, I see people like that who've actually had Charcot feet and have had foot amputations, and after that process, they're still able to get rid of their diabetes or to change their life. But the point I'm making is that disease lowers blood pressure, opens up atherosclerosis, so people are now getting rid of their restricted movement or restricted angina. I recently had a man coming into my facility who was 370 pounds. That's, I guess that's about
130 kilos.
162 kilos, yeah, wow, amazingly overweight. But he lost about 20 pounds per month for those first 3 months. So that would be he lost about 10 kilos a month. And of course he got rid of his chest pain, got rid of his diabetes, but he was non-diabetic. The point is he still weighed over 150 kilos when his diabetes went away, but he continued to lose weight and get healthier. He's not healthy, but at least his diabetes was gone after the first, 30 kilos of weight loss. So we're talking here about even when a type 1 diabetic, at the same time I had a type 1 diabetic come in on 200 units of insulin a day, and after that 8-week program of diet change, he only necessitated need 35 units of insulin a day and no longer has such highs and lows, because the excessive use of insulin in a type 1 diabetic that also accelerates their demise. Because insulin is a fat storage hormone, it prevents weight loss, it leads to more cellular replication and growth hormone production, and it increases the person's risk of cancer. So insulin is one of them. So the excess use of insulin in type 2 and the excess use of insulin in type 1 is one of the reasons why type 1 diabetics die so young and have such a high morbidity and mortality. All right, I'll pause here and stop for some questions you guys may have for me.
Any questions?
Any questions from anybody?
Yes, I've got a question. Not only impair the insulin, it will affect the liver as well as infiltrate the islet, beta cell. Do you recommend zero level of fat intake or restriction of fat intake? It increases the insulin resistance. It infiltrates the liver as fatty liver, and then it infiltrates the beta cell also. That means secretory secretory function of the beta cell, that is also reduced. Now my question is whether you will restrict the fat intake, or you bring the patient to zero level of fat intake.
So the lipo.
That's a good,
Yeah, go ahead.
I got it. I heard it. Thank you. That was an excellent question, and thank you for adding to just making that contribution. Yes, we're lowering the fat intake to a strong degree, but we're allowing a ½ ounce of nuts and seeds to be the major source of fat instead of oil, because oil is digested very rapidly, and the rapid digestion of an oil makes it go right to the fat supply, whereas nuts and seeds are absorbed at about 1 or 2 calories per minute, but the presence of the fat with a high vegetable meal helps facilitate the absorption of the phytochemicals. So you absorb 100 times the phytochemicals and antioxidants when you have some fat present at the meal. And the phytochemicals of the antioxidants are an important part in rejuvenation of the body and the restoration of beta cell function. So when the fats are absorbed very slowly from nuts and seeds, sesame seeds, almonds, walnuts, in place of oil, the sterols and stanols, these fibers in nuts and seeds, bind fat, and they carry fat so all the fat is not absorbable. It passes through into the toilet bowl. So the nuts and seeds are able to turn down the appetite by if you eat about 100 calories, but the 100 calories never come into the body. You only get about 70 calories of the absorption. So it makes them to reduce their drive to overeat calories. So yes, the diet is moderately reduced in fat, but it has between 1 to 1.5 ounces of nuts and seeds a day, usually a ½ an ounce with each meal, which takes the place of the fat to give that mouthfeel for a dressing or a sauce on the food, in place of using oil.
Thank you.
You get a very different biological effect when the fat comes from nuts and seeds in place of oil or animal fats. So yes, we reduce the fat, but we also change the type of fat.
All right, Doctor, one more question.
I am Dr. Patnaik. I am a retina surgeon. I do see a lot of retina cases in my clinic, and recently for last 6 months, because we are following the strict diet and exercise, what the home taking message is there, it is not only reduce the insulin or the antidiabetic drugs, because these medicine are chemicals, they produce lot of damage to the kidney or the liver and to the nervous system also. This is a very nice way, and I can see that even we are doing lot of laser photocoagulation earlier. Now that also incidence is reducing, and in diabetic macular edema we used to give an injection known as Avastin. Now also that is coming down. So this method, the proper diet and exercise and regular, and really this is helping us. Thank you, sir.
Thank you. That's a good point, because we're talking here about the reversible diabetic retinopathy. We actually see the pathologies going the other direction, and I've worked with a lot of eye doctors who see the same thing, that their diabetic retinopathy and macular degeneration is improving on the program.
So just one more comment.
Dr. Bhatia, you are seeing both words. You are an Indian based in US, so we'll like to have some comments.
Dr. Joel Furman. He's in New Jersey.
So, Dr. Joel, I have a question. You just advised that we have to restrict the diet of the patient. So, what are the what is the range according to you which should be advised to the patient? Roughly how many calories a day, and for how much time? How many weeks, say?
Well, you know what? This nutritarian diet I advise for all people, including people who are not diabetic. So I follow the same diet I recommend to the patient, and recommend all my clients and patients and followers. So I write books on how this way of eating slows longevity, reduces heart attack risk and dementia, and prevents risk of cancer. So I'm recommending all people moderately caloric restrict and eat a diet rich in phytochemicals and lower their body fat and exercise regularly. So the doctor becomes a living example of what they want the patient to do. And moderate caloric restriction means that you eat a meal so you're not full out of high fiber foods that fill you up, and then you don't eat again, or you adjust the amount you eat so you're hungry in time for the next meal. If you're not hungry in time for the next meal, you don't eat it. And if you're continually not hungry, then you're chronically overeating, and they try to adjust their caloric intake so they're always hungry for the next meal. So they instinctually lower their caloric intake to their own metabolic needs, not excess. So that means they're usually eating between, depending on the size of the person, their amount of activity they do, whether they're a male or female, and their own metabolic rate, they're adjusting their caloric needs to be slightly undershooting their own individual needs, and they use hunger, getting back in touch with instinctual hunger as their modulating device so they know they're not overeating. Because if they're constantly eating food and they're not hungry, it means they could have eaten less. So the person that says, oh, I'm doing great, I'm losing weight, I'm not hungry, that person is still chronically overeating. We want to let them think that, we want to teach them that hunger is favorable, and it's linked to their longevity, and they have to eat smaller amounts of food so that they can be hungry before they eat again. So we're talking here about eating some, I know I can't give you a precise caloric amount, between 1,000 and 2,000, because some people are obviously bigger and, are different, but we're all trying to moderately caloric restrict, and they're measuring their weight loss, because if they're not losing a kilogram a week, then they're not caloric restricting sufficiently. I want them to lose it. If they're overweight, they should be losing a kilogram a week until they get close to their ideal weight.
Thank you.
Dr. Furman, thank you. One more person wants to step in. Yes, please.
Let this be last, because we have 10 minutes for one.
Yes, please, come on in.
What would you advise insulin pump to a patient who cannot regulate her insulin, and the sugar level goes up and down very frequently and she gets disturbed? Would you recommend insulin pump to her as she's been suggested to her?
That's great, that's right. This man I was just talking about, the type 1 diabetic, hasn't had an insulin pump requiring 200 units of insulin a day as sugars were high and low. The inability the difficult control of highs and lows is really a diet issue, because when they follow this dietary program without the high glycemic carbohydrates, using beans as their almost only carbohydrate source, using green vegetables and berries and nuts, and lots of mushrooms and onions, they require so little insulin, even type 1s. And even if they require an insulin pump, their insulin needs are much lower, so they're not getting highs and lows, even if they exercise. So it's much easier on the patient taking more normal amounts of insulin. So the diet, most people on the diabetic pump are taking levels of insulin that are dangerously high, and they have to adjust their diet to control their sugars, not use more insulin to control their sugars. You have to limit the amount of insulin they're permitted, and they have to make the dietary adjustments so they don't require much insulin, and that's what they have to do to control their highs and lows.
Can she take advice from you? She often visits America also. So how can she take advice from you? There.
Right. I have a retreat where people can stay there for 4 weeks or 8 weeks or 12 weeks in San Diego, California, where a diabetic can come in and they can stay and live there, and I can take, gradually reduce their medications, feed them with our chefs making delicious food, and they're there to get rid of their diabetes and get rid of their high blood pressure and heart disease. And then we send them back with the skills of knowing how to make it taste good, how to teach them how to make the food taste good. We've got rid of their food triggers and food addictions, and we've taken care of their emotional and psychological needs to train them from all the emotional triggers of why they overeat and became overweight to begin with. So yes, I have a facility where people can stay there in San Diego if they want to be under my care.
Thank you.
Dr. Furman, thank you from everybody.
So big hand for Dr. Joy. It's almost midnight there, I think.
It's
4 a.m. So he's up for us. Thank you so much, Dr. Joy.
Dr. Furman,
Thank you guys for the excellent interest.
I'll give you
so excited.
I'll give you a review when you wake up at a normal time. And thank you so much.
Go to sleep now. Dr. Joy calling him junior. He's not so much junior. He's quite big now. But Junior Gupta is a business management graduate from Babson College in Wellesley. He has also attained an associate's degree from the Entrepreneur's Master's Program from MIT, and he has also spoken at TEDx and been awarded the Kalam Goodness Award from the former Indian President, President's APJ Abdul Kalam Center. And he used to live in the US. He moved back to India in 2013 to be closer to his parents. He has finally started Cure My Diabetes. After learning that diabetes is reversible, he decided that the only way to extend his own father's life is by doing this himself. Today he is bringing all the knowledge he has gained to us, and his treatment program is reducing medicines in 100% of patients and offers a hope to reversing the tide of this growing epidemic. So give a big hand to Junior Gupta for helping me organize all this. And the last words, and you can also summarize his talk, please, if anybody wants.
Yeah, definitely. So thank you everybody for coming here. Am I audible all the way? Awesome. So I'll run through a little bit faster than planned because we're running a little bit over. So why did I decide to start this? So I want to give you a little bit of my family history. So this is a very old photograph. This is when my father was younger than my son. That's my Tao. He died from diabetes complications. That's my Bua. She passed away from diabetes complications. Oh, yeah, there's the narrow. That's my dad. He has been insulin dependent for 25 years. He's had 2 bypasses and he has had 15 stents put in him. That's my Dadi. She also, towards the end of her life, was diabetic, insulin dependent. My mother is also insulin dependent. My Masi is also insulin dependent. And I can almost go into every family member that is insulin dependent. When I grew up, for me it was more a story about when I'm going to get diabetic, not whether. I'm happy to say I don't think that way anymore. So looking at my family history, जब हम छोटे थे हम syringe से पिचकारी खेलते थे. My whole thing is how can I make diabetes remission practical? Like you had asked, Dr. Furman has his clinic in California. You know, my father cannot go there for 4 weeks. My father cannot even go to a clinic in Delhi for 4 weeks. So the whole thing has been is how can we make it practical in our day-to-day setting? What can my father actually follow? So what I found was the first factor is taste. People aren't going to change their taste too much. It has to taste good. The second thing is convenience, and the third thing is compliance. Only when we have taste, convenience and compliance do we have a successful way to reverse diabetes. Not a theoretical way, but a practical way. So, in taste, these were some of my challenges. One is getting people to eat complex carbs. So, you know, मैंने brown rice बहुत बार बनाया, and dad's like, मैं नहीं खा सकता ये. Just yesterday I was talking to a patient, 75-year-old, and we make red rice idlis, and he's like, ये क्या है? मैं नहीं खा सकता. Avoiding starchy vegetables. So India में number 1 culprit in starchy vegetable is aloo. Aloo has very low vitamins and minerals. The potassium leaches away when we boil it, and so it's pretty much an empty calorie. And corn. So all of these are, you know, good if eaten in the right way, but the way we eat it, they're usually empty calories, and we eat too much of starchy vegetables. Reducing non-veg, reducing dairy. So those that eat non-veg, you know, red meat is bad for us. The quality of the meat of chicken has also now full of antibiotics and growth hormones. And when we talk about vegetarians, and vegetarians eat a lot of dairy as well, paneer especially. And so what we've seen, especially when you saw the glucose readings, it is that we are reducing their intracellular lipids. These animal fats and proteins do increase the insulin resistance with the way they bind in your body, especially in your liver and your pancreas. And also reducing saturated fats. So the oil that we eat, especially Indian oil, is not a very high grade. A lot of the oils that we get just barely meet FSSAI standards. So even when they go through one frying process, the peroxide levels go very high in the oil. and that makes the saturated fat stick to your body. So it's these taste challenges, how to get past all these taste challenges and make people enjoy it. So on all the tables we have a few small jars, and then in a giveaway bag we have more jars for you to take home of different items. So one of them is a fruit cream, that's in one of the small jars here. So diabetics love desserts. So we have created this fruit cream that is non-dairy. There is no dairy in that fruit cream. How many people have already eaten that fruit cream?
Please, you cannot taste it. It's
Yeah.
on your tables and the spoons
So for
are
the
there.
rest of you, please eat it. I'll answer at the end what is in that fruit cream. The second thing is we have given kefir, and I gave that as an example. Fruit cream tasty होगा? Fruit cream, देखो नहीं. Fruit cream will be tasty. Kefir, which is the other thing, is not as tasty. That is going to be little khatta. Kefir is a probiotic. It is, you could say, the mother lode of probiotics. दही हमारे 3 से 4 घंटे में जमता है, केफिर 24 घंटे में जमता है. It has 50 times more probiotics than yogurt. So the reason we give, yeah, so capsules are there, but you know, it's I just don't know about living the way this is vis-a-vis capsules. So a lot of our patients, like my parents, they are taking a small sachet of medicines in before breakfast. They take a sachet of medicines by lunch, and they take a sachet of medicines before dinner and some medicines after dinner. Now all these medicines destroy their internal digestive tracts, and our goal is to restore their digestive tracts. I mean, they start getting gas issues, constipation issues, IBS, all kinds of stuff, and our approach is very holistic. So has everybody had that fruit cream now? So that cream is actually a mix of tofu, and I know most of you don't like tofu or didn't used to. It's a mix of tofu and coconut cream. There is no added sugar, there is no artificial sweetener, and it has low sugar fruits in it that are not going to raise your, have a negative glycemic response. So that's a matter of taste. You know, how do we trick you into eating something you know, but it's not made of something that you normally eat it with. So coming to the next factor, it's convenience. So convenience is extremely important. A lot of people, and I use my father and mother's story. I bought them a really nice juicer. 3 हफ्ते बाद में वो juicer का कोई use नहीं हो रहा. So, you know, this is probably a factor in most of our lives and our extended families' lives. And you consult patients so often on what they need to eat. But despite knowing, you know, who has time to do R&D? आपने जो 3 चीज़ बनाई वो तो उन्होंने बना ली. अब 4थी चीज़, 5वीं चीज़, 6ठी चीज़, 8वीं चीज़, 10वीं चीज़ कौन समय लगा रहा है? It's not, practical experience shows it doesn't happen. And so that's why we have come up with the answer. It's the home delivery model. Increase the convenience, take out the doing part of it. They just have to open jars.
What is the time, by which time you can use them?
So this, I mean, I would say by evening, maybe by tomorrow. Depends if it was kept in fridge all day, then you could have eaten it until tomorrow night. Yeah.
1
Easy.
or 2 days is
Easy, yeah.
lifespan is 1.
Yeah, easy.
Kept at room temperature, how fast you consume it?
Now room temperature, ma'am, सर्दी में गर्दी में.
मतलब today.
At room temperature, you know, the fruit cream, I mean, I would say till evening, easy. Yeah, I mean, we are not food tech guys. We're nutrition guys. So we'll give it to you to eat fresh, because as it is, nutritional value is going down every minute. So my advice will be jaldi se jaldi kar. I don't believe in preservation.
And how much is the cost of these?
So can I come back to the questions? Otherwise, let me just finish the presentation. Then the question is how much is the cost? I'll be happy to answer that. The third point. So we talked about taste and we talked about convenience. When both of these are easy, the compliance goes up. So the other part which Dr. Hemi showed, and I've seen it in my own experience, people have a lot of issues. मैं ये नहीं करता, मैं वो नहीं करता. जब वो अपना इंसुलिन ग्लूकोज का ग्राफ देखते हैं ना ऑर्डर में सीधे आते हुए, और जब उनकी दवाइयाँ कम होती है, they are super excited. I have this one uncle, he has a EF of 20%, he has a CKD, he has a creatine of 2.9, and today we are his only hope. He's had a bypass and he's seeing 2-3 दवाई से 1 दवाई पे आ गए within 5 days. So that's going to decrease the load on his kidneys, and that's just in 5 days. So this is cutting edge science. There is no like studies done, ki, hey, this is the book, read the book. This is new stuff. But the compliance goes up, and that's my key factor, because my dad is a very stubborn man. So I need to do something that even he will take. So that's from the patient side. Now let me talk about you as doctors. What would be important factors for you? So we have a hygienic modern kitchen. All our chefs are professional. Our executive chef is from the Imperial Hotel. And extreme hygienic standards are maintained. Mesh hats are worn everywhere. You're welcome to come and visit anytime. Our product, food, has no side effects. There are no drug interactions to worry about. We use the best technology that is out there. We use the CGMs. We get body composition analysis done on the patients. So we are taking, though it's a very traditional product, we are using modern technology to assess the results of that. It is medically supervised. Dr. Hemi is there to consult with us on the patients. We do review, especially the more challenging patients, with Dr. Furman on conference calls. Gestational diabetes, for example, very serious, post-bypass, all of these things are reviewed. So we have the advisory board as well. So just quickly I want to talk about the vision. So my vision is to work with doctors to reduce patients' diabetes, because it has to be co-managed. It can't be that हम एक तरफ बोल रहे हैं आप ये करिए और आप दूसरी तरफ बोल रहे हैं इससे कुछ फर्क नहीं पड़ता है या ये नहीं करना है. So we want to co-manage patients with the primary doctor, which is you, and we want to see patients return to a non-diabetic state or as healthy a state as possible. And so that's what our goal is today. Do you have time for a video?
My name is Junior Gupta, and I am the founder of Cure My Diabetes. I have started this due to my strong personal connection with diabetes. I have seen diabetes all around my family. Today, clinical studies have proven that diabetes is reversible. In one published study, the DIRECT study, up to 86% of patients returned to non-diabetic biochemical marker. Here is an example of a patient who went from 163 units of insulin and out of control to 34 units and in control. He started his diet on this point, and we already lowered the insulin dose. We worked with doctors and the diet, and we lowered the insulin dose. Now just watch at 48 hours how his insulin changes. We actually kept lowering the dose, and within 96 hours of eating this food, his insulin usage had gone from 163 units to 34 units. And look at the level of glycemic control that this person has. What we bring is scientifically researched meal plans right to your door. All the food is cooked by professionally and specially trained chefs. All the meals are carefully proportioned for protein, fat, and carbohydrates. All the grains used are low glycemic. These foods put diabetes in remission. Because we also focus on nutrition and not simply calories, these nutrient-dense foods will also revive the beta cells in the pancreas. Our diet is so advanced, we use CGMs to monitor the effects of the diet. Here in our center, we have designated staff, including dietitians and consultant endocrinologists, to supervise these patients. We also have Dr. Joel Furman on our advisory board. He has been reversing diabetes in USA for over 30 years and is the author of 8 books on nutrition and disease. He is one of the world's leading doctors on diabetes reversal. As a doctor, you will get regular updates about the patient's progress. and any feedback regarding the need for medication modification. Today, we are helping type 2 diabetics, type 1 diabetics, and gestational diabetes. Obese patients will also see improvements. You can be sure that the Cure My Diabetes meal plan is the most scientific, hygienic, and advanced food subscription available in India today. My name is Junior Gupta, and I am personally guaranteeing improvements in your patients.
It works out to 125 a meal or 500 rupees a day, 15,000 for a month. So if somebody has to be on the program for 3 months or 4 months, it will work out to about 55,000 rupees with the 3-month package plan. By the way, for all the doctors who are here, since we're on pricing, we are currently giving a doctor discount because you have to try it to believe it as well. So
How much?
for doctors it is 12,000 a month. A month, yeah. 4 meals a day, 30. I mean, it works out to 125 a meal, and for doctors it will be maybe I think 80 rupees or 90 rupees a meal. Yeah.
Each meal is how many grams?
Each meal is how many grams? It varies. Like breakfast, high tea will be the smallest, breakfast will be second smallest, lunch and dinner will be heavier. I'll just say lunch where we give 250 grams of raw vegetables. So the lunch itself might be 400 to 500 grams, depends on what's all there. The dinner might be around 500 grams to 600 grams. So yeah, it varies. The calorie will be based on your height and your activity level, and according to that the grammage will be adjusted.
You said the cost per meal is
About 125. And then
So this meal is delivered at the door?
sorry, Ji?
This meal will be delivered at the residence?
Yeah, residence or office. It's one delivery a day. So in the one delivery, everything is made fresh that day. We'll give that day's dinner, and next day's breakfast, next day's lunch, next day's high tea. It's all done in glass. So शाम को जब वो अगले दिन आएगा लेने, you pick up previous day's jars या 2 दिन पहले के jars जो भी ready हैं, and keep switching out. So we don't throw away.
You can deliver in entire NCR?
Yes. In Noida right now we have not, we can if we have enough patients, but we are delivering to Panchsheel, GK, Saket, Gurgaon, Artikuram, Vasant Vihar. Based in Gurgaon. We are in a mall on MG Road, and one of the big malls.
Should I make a comment?
Yes, sir.
See, we are focusing on diabetes.
Yes.
I think we should focus on pre-diabetic, obese people also, because they are equally diabetic.
They are.
Because the
Yeah.
process,
No, we.
other processes in the body, I think are they started much earlier.
Yeah.
Compared to 10 years back.
I agree
Now
with
as
you.
compared to full-blown diabetes.
I agree with you that we can focus on obese, we can focus on pre-diabetes. The thing is that I have in my experience found that the more medicines a person is taking, the more benefit they feel it, right? When somebody is taking an injection and that injection stops, they feel it. Whereas if somebody was only taking metformin and that metformin stops, they never really went through all the pain. It's a wrong way to look at it, I agree.
If you are to tackle diabetes, you have to focus on pre-diabetes.
देखिए, I am willing to focus wherever I get compliance. I encourage everybody. I encourage everybody.
Excuse me.
Yeah.
Suppose we have a patient.
Yes.
So his first consultation, you know his height, you know his weight, you know his diabetic status or a pre-diabetic status, and then only you plan the meal. Right?
Somebody can go visit them at their house also.
Okay.
So convenience is a big factor.
Okay. So the patient doesn't have to go.
No, but we will want their blood reports and any other test results. But yes, convenience is part of this design.
Excuse me.
24 years old, somebody is 54
Okay,
years
your
old.
diet plan. So you are giving 4 meals. Do you restrict people from eating between the meals? Suppose he wishes to.
Meant for him. So we'll say, uncle, have 2 of ours, 1 of yours. So we want to accommodate within their lifestyle. You know, a person's identity is often defined by their food. So you can't take away their identity.